Congratulations on taking a first step to reduce your knee pain. Our team has the expertise and technology to create a solution that's just right for you. Let's get started with what's important to you. In this brief online seminar, we'll cover the common causes of knee pain, treatment options, when it's time to consider joint replacement, a brief description of our MAKO system that helps with less pain and a faster recovery, what to expect for recovery, and next steps. Your joints don't go bad overnight. The pain can be constant, come and go, come on strong when you're in motion, or after sitting still for a while. Pain can happen in many locations in your body that get a lot of use. One of the causes of joint pain is arthritis or osteoarthritis, which is a common condition. When cartilage wears down in the joints, the bones rub against each other, and it hurts. You can see the difference here between a healthy knee on the left and an arthritic knee on the right. Notice that the cartilage is worn away in the arthritic knee, which causes pain. Your X-ray may look like this. When you talk with a doctor about knee pain, your first discussion may be about lifestyle and weight management. For every pound that you lose, you can take 4 pounds of pressure off of your knees. Altering your diet and making low-impact exercises part of your daily routine can be a starting point. Using a walking aid can take pressure off of a hurting knee, or your doctor may suggest heat or cold therapy to provide some temporary relief. He or she may also suggest anti-inflammatory medication or an oral steroid for relief of pain. Physical therapy can also be a helpful option. Your therapist will work with you to recommend exercises that strengthen the muscles around the knee area. Cortisone may offer quick, effective relief, but can only be used a few times a year. Gel injections are also an option for a single dose or a series of 3 twice a year. And stem cell injections show some promise while research continues on this relatively new treatment. Insurance coverage may be limited. After you've tried conservative treatment options, asking yourself a few questions can help you know whether it's time to explore joint replacement. Things to consider include: have you had multiple arthroscopic surgeries? Are you less active because of joint pain? Does joint pain keep you from doing the things you want to do? Is joint pain affecting your ability to walk upstairs? Is joint pain affecting your ability to get a good night's sleep? If you can answer yes to one or more of those questions, joint replacement may be able to help you. Your doctor will recommend either partial or total knee replacement. Partial knee replacement only addresses the portion of the knee with damage, which may help minimize trauma to the healthy bone and tissue. When the entire knee is diseased or injured, total knee replacement may be recommended. A few questions you may have include: can I have an allergic reaction to the implant? Because joint replacement implants contain metal, talk with your doctor if you have a sensitivity or allergy to certain metals. Will the joint set off a metal detector? Yes, you will set off airport metal detectors. You'll need to notify airport security and possibly go through separate screening. TSA is familiar with these situations because joint replacements are so common. Is the implant heavy? On average, implants weigh less than a pound. The MAKO system used by our physicians is transforming joint replacement. Each knee gets a personalized surgical plan, and the precise MAKO system helps make it possible to protect soft tissue around the knee area. Patient and laboratory studies confirm accurate placement of implants, which can improve long-term success. Your doctor will order a CT scan of your knee that is turned into a 3D virtual model. It's loaded into the MAKO system software and is used to create your personalized pre-operative plan. In the operating room, the doctor follows your personalized pre-operative plan using the MAKO system to guide the robotic arm. The MAKO system helps the doctor stay within the plan boundaries of the plan's predefined area. The doctor is also able to make adjustments to your plan during surgery as needed. Your doctor can assess the ligament tension, limb alignment, and flexion or extension gaps in real time during the procedure. Surgeons control both flexion and extension adjustments during the procedure before bone preparation. It's like having a tire that's well aligned. How long has the MAKO procedure been available? The first MAKO procedure was in June 2006, and since then, doctors around the world have performed joint replacements with the system. Does the MAKO robotic arm actually perform surgery? No, the robotic arm doesn't perform surgery, nor can it make decisions or move without the doctor guiding it. After surgery, our doctors, nurses, and physical therapists will set goals with you to get you back on the move. Individual results will vary, and not all patients have the same post-operative recovery. Talk with your doctor about the potential risks and benefits. Joint replacements will not allow you to do more than you could do before you had joint problems. Talk with our team about the most appropriate level of activity. Most knee joint replacement patients may return to driving as soon as 1 week after surgery. Partial or total knee joint replacement may be an option for people who have tried conservative measures to reduce pain, but still have a reduced quality of life due to knee pain. Talking with a doctor can help you understand your options. Schedule an appointment and take a step forward for a future that could include less pain.